We are back, and tonight we are talking about what's going on with my irritable bowel, irritable digestive system, IBS, IBD. I am Dr. Trevor Miller. This is my wife, Jessica Miller. Ladies first, give them your creds.
I'm just a registered nurse.
Just a registered nurse with 13 years, the person they always went to so they could draw blood. You got all the difficult patients.
Well, I mean, I didn't get all the difficult patients, but eventually I did get a lot of them.
And my name is Dr. Trevor Miller, and I have been in the functional medicine space since 1996. My children actually brought me into this space because I wanted to help them. And in that amount of time, it went from, that was before functional medicine was even functional medicine. And I started to develop what I wanted to do, how I wanted to do it, and how I could help my children. And then it just eventually started to happen for my patients. And I am double certified, one from the University for Functional Medicine and one for the Institute for Functional Medicine. And so that is who we are. We are Integrative Health of Indiana. We are the treating partners, and that's how we treat everybody. And so, real quick, an update on one of our patients most recently. You go ahead. You're proud of this one. You're happy.
Oh, we are so excited because we had a patient come in that wanted to have a baby really bad, and so today when she come to see us after we hadn't seen her for a while and I was worried about her, she let us know that outside of her husband, we were the first to know that she was going to have her baby.
So she will give us an update after she delivers the child. But our goal was to have conception. And so we have conception. So our job is done. And we're very happy for her.
We put ourselves out of business one more time.
Yep. And that is, that's what we're here for. Now, let's talk about irritable bowel.
I just get tearful just thinking about it. I'm just so excited for her.
So, why does somebody have diarrhea? Why does somebody have chronic diarrhea? So, why does somebody have diarrhea acutely?
Acutely from stress, something bad that they've eaten, or parasites in the water.
Colonoscopy.
Bowel prep.
So,
medications. I mean, acutely multiple things.
And it's normal to have diarrhea once in a while, especially if you've traveled outside of the United States, or if you went to someplace new and you drank contaminated water. It's normal to have it for 2 or 3 days, and it should clear up.
And you shouldn't stop it. If you know you've eaten something bad, or you have what people love to call food poisoning, it's the way your body expels that bacteria. So hydrate yourself and let it pass. But I mean, if you go greater than 3 or 4 days, then you might need a little to ask for help just to make sure. But don't stop an acute episode of diarrhea. Just support yourself.
And so when we see people with this, when we see people like this, we immediately, because the people that we see have not been suffering with diarrhea for 3 or 4 days. They've been suffering with chronic episodic diarrhea
months
to years. And so first thing we do is we start to look at the gut markers. Let's just get us off of there. We start to we'll do a test, and we want to see how does the gut look. And so if you look at this patient, you immediately see that elastase is very low. Elastase is an enzyme that helps you break down food. And when you have infections like this person does, let's switch it. So when you have all of these opportunistic and overgrowth bacteria, well, they start to form biofilms and they will start to degrade the villi.
And that is a lot of infections.
Yes. And so this person's gut will start to degrade the villi. And so then what happens is you start to see things like pancreatic elastase is low. Steatocrit might be very high, which means there's fat in the stool, so they're not getting cleared. And the funny thing about this is, medically, they don't pick this up. This person's been everywhere. And so medically, they don't pick this up. And when they don't pick this up, or they don't think this isn't life-threatening, this person gets around, really doesn't have much of an issue with anything, doesn't have a lot of pain. And to look at them, you would think that they are, quote, healthy and normal. But once in a while, they'll go through bouts of explosive diarrhea. And so when we did this test, go ahead, sorry.
I'll finish when you did.
So when we did this test, we see lots of little things that say, oh, yeah, the system isn't right. So pancreatic elastase, this says it should be greater than 200. We actually look for that to be greater than 750. And then when you look at beta glucuronidase, this person eats about 30 grams of fiber a day. And beta glucuronidase is a sign of estrogen dominance or overbearance. And so this person does not have any problems binding this to get it out, but yet the beta glucuronidase is high. When we look at the gut health secretory IgA, antiglidin IgA, both are in the good. I don't like seeing antiglidin IgA this high, and it correlates to the zonulin. So this person is eating too much gluten, which is causing the calprotectin, this inflammation, to start to increase. And calprotectin is inflammation inside the gut. So we started to help this person's gut, and we did a lot of different things. We did probiotics, we did gut repair stuff, and it all went away. And we're waiting. We're going to get another test on them coming up here in the next couple of weeks, actually. So when we look at this is the first thing we look at. And you were going to say something on this.
So this isn't typical. So even for us, like, we've seen some pretty bad ones, but you usually don't see somebody that has a yeast or fungus and then all of this red light up. So this is not a typical patient or that we would see.
This is typical when we start to talk about biofilms and the stripping away of.
That's what I was going to say. Is this a first test or a second test?
This is a second test.
Okay, because I was thinking I knew who this was, and this is after we've treated for dysbiosis.
Mm-hmm.
Okay.
And so the funny thing is this person feels great, but we still see some H. pylori. All of the acid reflux in this person is gone. They don't have any pain with it, but that doesn't mean that H. pylori doesn't affect different areas. So they might get rashes, they might get itching on the skin, they might have psoriasis flare up, but then all the commensals look pretty good. We have a couple of high, and when we see these super high like this, we know that hydrochloric acid itself is too low, and we need the hydrochloric acid because that helps cull actually all of these bacteria, and it really starts to help kill this off and not allow it into the gut. And then we've used enzymes and some antimicrobials, and I will be very, very interested in seeing how this does, because we are actually treating biofilms in this person. But that's a significant case, and that is a chronic case. Typically after the first one, those things clear right up, but that one's just very interesting because.
Is this person a healthcare worker?
Mm-hmm.
And so that can be typical for people that work in the health field because they're constantly being exposed to things over and over and over.
Exposed and reinfected. But once again, this person, to see them, they exercise, they eat right, they don't have any pain. They just know that something is not right. And something, not only will that give somebody diarrhea and constipation and stuff like that, but that will also make somebody resistant to losing weight. That will make them God, that can affect the thyroid gland, that can affect the gut, that can affect the adrenals. I mean, it does a lot. And so, going back to the acute case of diarrhea, like she said, let that run its course. Make sure you're drinking plenty of water. Make sure you're getting good fiber in. Please, for the love of God, you've heard us say it a million times, quit eating crappy foods. Stay away from anything that comes in boxes and cans. If it has a UPC code, it's not real food. And when you are hurting and you have diarrhea, you absolutely have got to get away from those things so that you don't cause more inflammation and more problems. And the problem is when you're younger, you can get away with that. When you get older, you can't. Your body doesn't bounce back. It's like having a classic car. You can run a classic car hard once in a while. You just can't run it hard 24/7, and you have to give it more love. It's no different with your body. If you have an acute case of diarrhea, you have to give the body time to recuperate. It's normal to be tired. Lay down, give your body some rest. Make sure you're drinking plenty of water because you do not want to get dehydrated. And make sure you're eating good foods because that is what will bring you back. And when you are in the throes of it, you're not going to feel like eating much. So, soups, broths, easy stuff. What would you suggest nutrition wise for
For
somebody?
somebody with diarrhea,
Yeah.
well, so we call it the brat diet: bananas, applesauce, toast, and rice. It's bland, it's got fiber, it bulks up stool.
Huh. Never heard of that. So, for me with diarrhea, I have always just had
Clear liquids.
clear liquids, bone broth, because bone broth has glycine in it that helps the stomach heal. It has amino acids in it, which help your gut bugs. It has enough micronutrients that allow everything to repair. And so bone broth is actually fabulous. In the winter time, if you have access to bone broth and making bone broth, absolutely do it because that is better for you than a cup of coffee. It's better for you than a Starbucks. It, it's crazy how good that stuff is for you, especially if you make your own. So I see that we have several sets of eyes on here. Does anybody have any questions? And just pop them into the box, post a comment, and we will be happy to address them. But once again, acute diarrhea and constipation stuff, let it run its course. If you are new to eating fiber and you're used to the typical American who gets between 8 and 12 grams of fiber, and people that come and see us and we slowly ramp them up to 25 to 30, as we ramp them up to 25 to 30, we tell them
There's a learning curve.
yeah, your gut has to catch up and you may be constipated for a day or two. Typically, people are constipated for about 3 days and then the dam breaks.
Yeah, I was going to say most of them get ferocious diarrhea.
Mm-hmm. And that's because the bugs are coming back in, they're repopulating. But you do have to be careful, because when you have something like this, once again, and you're seeing these bacteria themselves be so high, that says that the hydrochloric acid is low. And when a hydrochloric acid is low, it allows bacteria to start to overgrow. And so that's when you start to hear of things like SIBO small intestinal bacterial overgrowth or dysbiosis or whatnot. So, well, with that all being said, we hope you guys are being happy, healthy, and safe. And until next time, you can reach out to us at Integrative Health of Indiana. We would be happy to help you in any way we can, and we love answering questions. You have a great night.